Hey, this is Dr. Todd Brennan. We are working today on a cryosurgery for a chronic foot neuroma. How long have you had this for? 15 years, so 15 years. So a lot of the people that I tend to see with for cryosurgery specifically do tend to have been dealing with them for many of years. Some of them have been through surgery in the past with variable success rates. So again, this is a good alternative to prevent, the more invasive surgery with a more minimally invasive option and allow regeneration of the neuroma itself. So we use a little tiny blade here, just a little stab incision, just to get through the top layer of the skin. And then we get the probe. So what we want to do is we get the probe in there, and then I'll verify under the ultrasound here, but basically we're between the two metatarsals. And as I was telling the patient, there's a little ligament underneath there that we kind of pop under. And I know I'm under it when I move and the toes kind of go with me there. So grab the ultrasound here. So the ultrasound just helps to verify location of the probe for us to make sure we're where we need to be. So we got the probe moving and then the neuroma's underneath of it. Ultrasound is just a good guidance to it. It's not necessarily a necessity from this standpoint, just because of the anatomic landmarks that we look for. Okay, perfect. All right, let's get things rolling. So once we're in that spot, we'll get the machine rolling, fired up. So this is the cryosurgery machine, just to basically gets all that nitrous oxide into the area. Go ahead and start these. So yeah, so it's just a freezing temperature at the location of the nerve. What it's trying to do is the same concept. If you fall and you hurt your elbow, you put some ice on it, it helps make it feel better. Same concept, we're trying to get the ice directly on the neuroma to basically try to shed the damaged, injured nerve tissues and let it to repair itself.
Why would someone go with this over alternatives?
The main reason you would want to go over this or go for this versus the alternatives, I mean, primarily once you're to the point of surgical intervention, if you will, there's really no complications or risks associated with this, which is the biggest one. Worst case scenario is you fall within the 15% of the people that it doesn't work well on. Other than that, there's no other risks associated with it. Where the traditional surgery, you're looking at stump neuroma, for instance, which is the biggest concern. You can actually see here now on the nerve, the ice is kind of forming over that. So you can see at the end of this wiggling thing, there's a big black area. So that's the ice ball that's forming at the tip of that probe, okay? Which is obviously what we want to see.
What are some signs and symptoms people may experience which would get them to consider looking into getting this procedure?
The biggest one is any tingling, burning, sharp shooting sensations to the toes. Those are the most common signs and symptoms that we would see here. It might extend towards the toes. Some people have a ball or bulbous feeling underneath the ball of their foot that doesn't feel good either. Those are kind of the main ones that we typically see, or just any type of unexperienced weird pain or sensation. Nerves, generally speaking, in the body have the tendency to present just oddly if it's a type of pain that's even hard to put words on. So now we did our first 2-minute freezing session, so now it's basically a 30-second intermission. We kind of just let it thaw out and then we hit it again with another 2-minute freeze. I like to keep the probe in while it's there just because we're at a good spot and we want to maintain that spot. So at 2:30 we hit it again, open it up for 2 more minutes, and then that's pretty much it. And then we'll do the PRP, which are the injections at the end. That's the platelet-rich plasma that we get all the blood from.
So this procedure isn't performed by many people throughout the country. Why is that?
Really the main one is just the technology and the equipment's not available. It's just not out there. So I want to say maybe 10 to 12 people offer it in the country. Lucky enough, privileged enough to be one of them. So, I've been doing it now for probably 8 to 10 years. It's really good, at least I think, pretty good track record. So yeah, it's just the equipment's not there, unfortunately, anymore, and there's nobody to repair it. So once it breaks, that's it. How you doing?
Good.
Feeling all right?
Yeah.
No pain, no sensations or anything? No?
No.
So how far are you from Myrtle Beach?
4 hours.
Oh, okay. Did you guys get hit with that big hurricane that rolled up through there, or were you further enough
Yes.
east? You did?
We did.
Oh, man.
We have family all over Florida and North Carolina.
Oh, gosh.
That lost everything.
Oh, man, that's awful. I'm sorry to hear
It
that.
was pretty bad.
Yeah. Yeah, it was a rough summer, for sure.
Jeez, what you guys went through too. Ooh.
I say we got lucky with Milton, because if it would have hit north of us, hit direct would have been awful, but north of us, we would have gotten all those influx of tidal waves and stuff, which would have been awful after what we dealt with Helene,
Yeah. I get chills watching it on the news.
Yeah. We're not in an evacuation zone where we live, so we decided to just hunker down and stay. But I told my wife after that, I was like, I don't know if I'd feel comfortable staying with anything stronger than what we dealt with. Considering it didn't even, it hit down in like Sarasota area, you know?
Yeah.
Watch sitting in the house, you know, and you know, Cat 3 winds 120 miles an hour and watching your doors bow. That's like, that'll freak you out a little bit. That is it. So we turned the machine off, kind of let it thaw out a little bit. Obviously that big old ice ball is not going to come out through the skin. Just slide it out. And you can see here, we're talking about a tiny little incision, right? A little neosporin, and this will be healed in 2 days, basically. And last but not least, this is where we do the PRP. So the blood we had drawn, spun down, and inject it back in. So basically I'll inject it back in along between the metatarsals where the neuroma is, and it just facilitates and helps with the healing process. Every once in a while we have somebody that's a hard stick that we can't get their blood, and if that's the case, that's all right. The cryo is the star of the show, not the PRP. You shouldn't feel any of this either, right? Again, it may just feel pressurized. Doing okay?
Yep.
Yeah, so I tell everybody they get a very full sensation because it's a small area and we're injecting and putting a lot of stuff in one spot. So, doing okay still?
Yeah.
One more injection, then we'll be done. Okay. Do you have any questions for me?
No.
That's it. Yeah, so the aftercare for this is super simple. Again, it's another perk of this versus the traditional one. So I'm gonna just wrap her foot up now. Whenever she takes a bath or a shower later, she takes the whole dressing off, and she'll just put a little dab of antibiotic ointment, basically where the little stab incision was on the bottom. She'll do that every day for only a couple days, really. Typically for out-of-staters, I do the procedure on a Monday, follow you up on Wednesday, make sure everything looks good, and then they're good to go home. And then after that, pretty much in a walking boot for 2 weeks. That just lets everything calm down. As we said during the procedure, it's a pressurized area, so it's gonna feel very full. So that's what the boot helps take some pressure off of. After 2 weeks, the transition period out of the boot back to nice wide toe box shoes, just to help keep the pressure off the forefoot and nothing that's gonna pinch the nerve. That's for up to 6 weeks post-procedure. And then from 6 weeks to 3 months is where I usually remove all the restrictions and have you get back to basically normalcy and really test the foot and see how things feel following the procedure. How would you say on a scale of 1 to 10, pain-wise for the procedure?
I'd say maybe a 2 for the injection. For the anesthesia, but other than that, nothing.
Perfect. Did you have any cold sensitivity at all while we did it? No? Good. Yeah, I told her before, some patients do experience where they feel cold. It doesn't necessarily hurt, but they notice that it's, say, colder than the rest of the foot, but it doesn't necessarily hurt. So usually what most people feel is touch or pressure. As she stated, the shots are just, there's no way to make them easy, but pretty straightforward, pretty simple, and she's on her road to recovery and getting rid of this 15-year-old neuroma.